My name is Ashanti Hightower, and I am a psychiatric and mental health nurse practitioner student at Arkansas State University, and I will be demonstrating a return exam that includes the cardiovascular system, the respiratory system, peripheral vascular system, axilla, and breast exam. This is the 360 of my room. Here's my patient. Here are my supplies. Ceiling. Okay. Okay. Hello, my name is Ashanti Hightower, and I'm a student at Arkansas State University, and I'll be completing your physical exam today. Is that okay with you? Okay, I will start with hand hygiene. I'll start with the respiratory system. I am inspecting, assessing for any signs of distress, looking for chest rise being symmetrical, which they are. The patient is comfortable. She has no signs of distress. Her inspiration is longer than her expiration. I also move around her lateral and posterior sides to make sure symmetric chest rise is symmetric. There's no signs of intercostal retractions or accessory muscle use. Her rate, rhythm, effort are regular. Her breathing is unlabored. Respiratory rate is about 16. Her AP diameter assessment is normal, less than 0.7. And her body shows no signs or symptoms of barrel chest, pigeon chest, sunken chest, or flail chest. Shows no signs of those deformities. Everything is bilaterally, no retractions bilaterally, symmetric chest rise, no deformities bilaterally, no signs of any lesions or masses. Skin color is appropriate. I'll palpate her chest, and she has no tenderness and no bruising. I'll palpate the posterior chest, no tenderness, no bruising, no masses or lesions or scars, and her chest is normal color. Now I will percuss her posterior chest. Turn that way just a little bit. Using your back toward that way. Oh, right. Using appropriate technique and ladder pattern and crossing her arms in the front. I'll use my middle finger and percuss by briskly tapping the interphalangeal joint of my middle finger with my other middle finger in a ladder pattern. And her percussion sounds are resonant throughout. Now I will auscultate breath sounds. If you could please take slow deep breaths with your mouth open. I'll use my diaphragm in a ladder pattern. Her breath sounds are clear and vesicular throughout. She has no signs of adventitious breath sounds. There's no wheezes, rails, crackles, or rhonchi. Okay. Now and she has no asymmetric movements, and there's no lagging in her respirations. And I'll move on to her cardiovascular assessment. Starting with inspection. If she's going to lay supine at a 30-degree angle, I'll assess her neck and using tangential light. If you could look that way for me. I'm assessing her carotid artery and jugular vein, and they are regular. There's no distension bilaterally. Now I will palpate her neck one at a time, palpating her carotid arteries one at a time, and assessing for pulse and amplitude, distension. Bilaterally, Her pulses are 2+. There is no distension bilaterally. I did not feel any thrills bilaterally, and pulses are equal bilaterally. Now I will measure her JVP using a ruler, using her sternal angle, and doing that bilaterally. And it is appropriate bilaterally. Her JVP is at 2 centimeters, which is appropriate. And she has no signs of jugular vein distension or deformities. She also has no masses or no lesions, and her skin is warm bilaterally. I now will auscultate. I'll start by auscultating for bruits. If you could hold your breath, I'll use the bell of my stethoscope. Okay, you can let go. And no bruits are appreciated bilaterally. I'll now use the diaphragm of my stethoscope to listen to her heart sounds, starting with her aortic valve at her right second intercostal space, pulmonic valve at her left second intercostal space, Erb's point at her left third intercostal space, tricuspid valve at her right sternal border, and mitral valve at her left midclavicular fifth intercostal space. Now I'll switch to the bell and do the same with her aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. And she has S1, S2 are noted, rate and rhythm are appropriate bilaterally. She has no S3 or S4 sounds. She has no systolic or diastolic murmurs, and no rubs or gallops. Okay, you can sit up. I'm sorry, lay back down. And I'm gonna palpate the pulse, point of maximum impulse, which is at her fifth intercostal space, midclavicular line, left midclavicular line, and it is normal. It is regular in amplitude and rate. Okay, now I can see that. Now I will assess her peripheral vascular system from her groin to her soles of her feet, looking for even regular color, symmetrically and bilaterally. Her color is even. There's no hypo or hyperpigmentation, no scarring, no rashes or lesions. Hair is distributed evenly throughout. Her legs are symmetric, and the soles of her feet, there's no ulcers, drainage, lesions, all the way down to the soles of her feet. So now I will palpate. First I'll palpate her femoral pulses, verbalizing, and her inguinal lymph nodes. Her femoral pulses are 2+ and equal bilaterally. Inguinal lymph nodes are not enlarged and mobile. Popliteal pulses are 2+. Posterior tibial pulses are 2+, and dorsalis pedis pulses are 2+, and they're all equal bilaterally. Using the dorsal side of my hand, her skin is warm and dry. Can you stand up for me? There are no varicosities present, looking anteriorly and posteriorly. And I also looked at her respiratory system anteriorly and posteriorly and laterally. Go ahead and have a seat. She has no swelling on her lower extremities. I will check for pitting edema by pressing my thumb into her shins for 5 seconds. 1, 2, 3, 4, 5. The dorsal side of her foot for 5 seconds. 1, 2, 3, 4, 5. And her medial malleolus for 5 seconds. 1, 2, 3, 4, 5. And there is no pitting edema bilaterally. Hair distribution is equal. Cap refill, using my thumb. Checking for blanching is cap refill is less than 3 seconds bilaterally, which is appropriate. Okay, now I will do her breast exam. Currently her hands are on her sides. I will inspect her breasts for color, shape, symmetry, and contour, which are all regular. There are no, and her nipples have no retractions or inversion, no discharge bilaterally. Her breasts have no dimpling, no thickening, no pores, no lesions. And then Then she'll repeat the exam with her hands pressed firmly on her hips. And the exam is the same bilaterally with her hands in the air. And the exam is the same bilaterally. And then leaning forward. And that exam is the same bilaterally. Now I'll ask her to lay back, and you put the ipsilateral hand behind her head, and I will palpate. I'll verbalize palpating, and she's also dressed in a discreet gown since the beginning of this exam, and I will use small concentric palpating motions to test for lumps, lesions, masses, or deformities in her breast bilaterally, and there are none. Using the ipsilateral technique, I'll also palpate her areola for elasticity, and there's no deformities. Her color is appropriate. There's no discharge, and there's no deformities. Okay, you can sit up. Now I would do the same exam for a male, but I would be inspecting for gynecomastia, any ulcers, any deformities or masses, which there would be none. I would also palpate bilaterally for any nodules or drainage, there's no drainage, I'll palpate for nodules, there are no nodules. I would compare any fatty tissue from glandular tissue, which would be appropriate, and I palpate his areola for any thickening or lesions. Okay, now the axilla exam, I would inspect her axilla to make sure they're symmetric bilaterally in appropriate color and warmth, or appropriate color. Then I would palpate. She would grab my left hand when I'm palpating her right axilla. Right hand palpating left axilla. Out. Using a cupping motion. Palpating her central lymph nodes. And then I will palpate for her pectoral lymph nodes, her lateral axillary lymph nodes, central axillary lymph nodes, infraclavicular lymph nodes, and supraclavicular lymph nodes, and there's no enlargement or swelling, and they're mobile. And I would repeat the same exam for the left side. There's no, using a cupping motion, there's no enlargement in her central axillary lymph nodes, her lateral axillary lymph nodes, her pectoral lymph nodes, also her infraclavicular and supraclavicular lymph nodes, and there's no swelling, no enlargement, no lymphedema bilaterally. And no tenderness or swelling, and they're all mobile and appropriate bilaterally. And thank you for your time. That is an exam.